And now, Healthline with award-winning medical correspondent Phil Rainier.
You hear a lot about how clogged arteries can cause heart attacks. Well, in the leg, they can lead to amputation. A new device called the Wildcat in Baton Rouge is making it easier than ever for surgeons to make sure that does not happen. Traditionally, many doctors have relied on major surgery to bypass clogged arteries and restore blood flow to the legs. The Wildcat makes it possible to literally drill through a blockage.
And we have many patients who all the other devices have been tried in multiple hospitalizations, and then we've used our device, and some patients have been able to prevent amputations.
The Wildcat allows you to intervene using what's called endovascular technology. It's a needle puncture as opposed to an incision or multiple incisions down the leg.
After the Wildcat procedure, patients usually get out of the hospital the next day, sometimes sooner. We'll have more on this innovative new procedure in Healthline at 10 o'clock. Now,
there was a time when someone with severe blood clots in their legs had no choice but to have major surgery.
Well, in fact, in some cases, their legs had to be removed. Well, tonight at 9, Healthline, Phil Rainier tells you about a new technology in Baton Rouge that all but eliminates those dire consequences.
Zap Daigle has peripheral artery disease. That's when clogged arteries in the lower body cut off blood flow to the legs.
I was able to walk slowly and do, normal things that I have to do, but if I accelerated it and, just pushed it a little bit, I would have to stop.
Instead of major surgery to bypass the blockage that's causing his pain, Daigle's opted to have something called the Wildcat procedure. It's new technology that allows doctors to insert a tiny drill into a patient's vein, literally boring through the length of a blockage. That makes it possible for Baton Rouge vascular surgeon Glenn Schwartzberg to insert a wire to guide a device he'll use to shave plaque from artery walls and then remove it.
And if you get off center, you can perforate the artery, you can tear the artery, and that's when you have the complications.
Complications like that can be life-threatening. The Wildcat all but eliminates those kinds of risks. This may look a little bit like a worm, but it's really the stuff that was blocking the flow of blood to Mr. Daigle's leg. With the blockage now out of Daigle's artery, blood once again flows freely to his lower leg. Peripheral artery disease not only makes it painful to walk, in extreme cases, it can lead to amputation.
And we have many patients who all the other devices have been tried in multiple hospitalizations, and then we've used our device, and some patients have been able to prevent amputations.
The best part is the Wildcat procedure can be done through a single tiny hole. Most patients get out of the hospital in a day. With Healthline, Phil Rainier, WAFB 9 News.